Without safely managed excreta, you don't have safely managed water. So really, when we talk about source protection, you should almost really talk about treating the wastewater first so it doesn't actually impact the source. So really, that safely managed sanitation piece has been lacking for a long time, and because it's maybe not as tangible for people, particularly in developing countries, to donate money towards sanitation, it's not as, let's say, appealing as donating money for HIV/AIDS or reduction of other types of diseases. But really, public health, from a public health standpoint, that's where it all started, was reduction of disease from wastewater.
Yeah, the other thing that pops up, and this has been popping up for, I guess it's not popping up, if it's popping up in the last 20 years, is that when you go into a community and provide water supply, commonly available for sanitation, you then create the problem of what to do with sanitation. And the public wants the public water supply, but the cost of actually effectively handling sanitation in developing countries it's light years away for the worst or the last portions of the populations we're trying to hit. So we actually create a portion of the problem when we go in with water first, when we don't address water and sanitation simultaneously.
I would agree, and I'm not sure that in the developed world the way we've managed water and sanitation is really the best approach. And there's now this theory that you could potentially, in developing countries, leapfrog the rest of the developed world. For example, with cell phones. In a lot of developing countries, people went to cell phones and there was no landlines because of that infrastructure. Well, you could look at water and wastewater infrastructure in the same way, in that maybe we shouldn't be flushing our toilets with treated drinking water, and really that people should be using water for what they call fit for purpose. So water that is clean to a point for the purpose it's going to be used for. So really more innovative options for water and sanitation technologies, I think, is what's required.